One of the most common practices in hospitals is the use of medications. Because drugs are used so often in the hospital, there are a lot of opportunities for mistakes with those drugs to be made. The way that drugs are administered to patients can sometimes cause harm. These are known as adverse drug events. A study published in the Canadian Medical Association Journal in 2004 showed that out of the 2.5 million patients admitted to hospital each year, over 44,000 will experience an adverse drug event. On average, adverse drug reactions prolong hospital stays by 4.5 days and have an annual added cost to the healthcare system of $300 million. Of all the drugs that cause adverse events, almost 60% are caused by what we call high alert medications.
The third is to prevent harm from high alert medicines. We're focusing in on three killers, three harmers, anticoagulants, then the combination sedatives and narcotics, and insulin. A tremendously high rate of consequential medical injuries in hospitals are due just to these offenders.
So what exactly is going wrong with drug safety? How are errors being made with these medications? Most errors occur in the stage when the drug is ordered or prescribed. In the healthcare system, it is standard practice for physicians to use shorthand abbreviations when writing out prescriptions. Many of these abbreviations are frequently misread and can lead to serious mistakes. For example, the abbreviation for every day is QD, and the abbreviation for every other day is QID. A poorly written prescription could easily cause these two abbreviations to be mixed up. Poorly written prescriptions can affect whether or not the correct dosage is given to a patient. This clip from an FDA patient safety bulletin shows a common error in the prescribing of medications.
Trailing zero after a decimal point can make 1.0 milligrams look like 10 milligrams if the decimal point isn't seen. Similarly, 0.5 milligrams can look like 5 milligrams.
Another way that errors can occur when administering a drug is by mixing up the names of the medications. Take, for example, an incident where a 69-year-old man was ordered 10 milligrams of morphine in the emergency department and instead received 10 milligrams of hydromorphone. This caused the man's breathing to stop on his way home from the hospital. Research into drug-related adverse events in hospitals show that 66 to 80% of these incidents are preventable. So how can routine healthcare procedures such as prescribing or administering drugs be made safer for patients? The Institute for Safe Medicine Practices has made a list of common error-prone abbreviations and has called for physicians to eliminate using abbreviations altogether. By writing out a prescription in its entirety, the chance for misinterpretation can be greatly reduced. Another goal of the Institute for Safe Medicine Practices is to educate healthcare workers about drug names that are commonly confused, as well as changing drug names to reduce confusion. After the case of the man that received morphine instead of hydromorphone, the name of hydromorphone was altered to make the difference more obvious. In conclusion, the solutions to eliminate drug-related errors come down to the clarity of prescription ordering. Isn't it time for you to consider the ways your script writing habits might be misinterpreted and work to improve those habits? Here are some exam questions that considers the material we just covered.